Welcome to the GMC Plab Objective Structured Clinical Examination, the OSCE. This video will explain everything you need to know about the way the exam works. Afterwards, we'll be happy to answer any questions you may have. When you enter the examination area, you'll find a circuit of test stations, each with their own number. You follow this circuit around from station to station in numerical order, spending 5 minutes at each one, so the whole exam will take about an hour and a half. Before entering this briefing room, you should have been given a name badge, which you must wear all the time, and the number for the station where you start. We will escort you into the exam area and show you your first station. Please wait outside this station until every candidate is in place, and then we will begin the exam.
You have 1 minute to read the instructions.
You have 1 minute to read the instructions which are posted on the wall outside each station. At the end of that minute, there will be an announcement to begin and you can enter the station.
Begin.
The examiner will check the name on your badge against the name on your mark sheet. And then you can begin the clinical task required as in the instructions.
492. Okay, you may proceed.
There's another copy of the instructions inside the station. After 4.5 minutes, there will be an announcement warning you that you have only 30 seconds left to complete the task.
30 seconds.
Please stay at the station, even if you have already finished. After 5 minutes, there will be an announcement to move on.
Move on to the next station.
Now you must leave the station promptly and go to the next one. You move on in numerical order, but if there's any confusion, don't worry. There will be staff around to point you to your next station. You have 1 minute to get to your next station and to read the instructions there.
Begin.
When you hear the announcement to begin, enter the station. This cycle goes on until you've visited all of the stations.
Where do you live?
At some of the stations, you'll find an actor playing the part of a patient. At others, where an intimate examination or invasive practical procedure is required, there will be a model or a mannequin. Don't worry if the examiner doesn't talk to you much. They are there to observe, not to contribute. However, there are a few occasions when the examiner might speak to you. He or she may have a role to play, being a patient on the telephone, for example, or you may be asked for your diagnosis. An examiner will also interrupt if you are about to cause pain to a patient or are not performing the task requested of you. For example, you are taking a history when the instructions ask you to carry out an examination.
Doctor, could you reread the instructions, please?
At least one of the stations is a rest station. Here there is no task to perform. It's a chance to take a 6-minute break, to sit, relax and have a drink of water. There may also be a pilot station, which will not be labelled but will look like all the other stations. This is where we are trying out stations for future exams. You will therefore sit 16 stations, although you will not receive a grade for the pilot station. There may be an observer in some of the stations you enter. The observer is there to observe the examiner in the station. Alternatively, there may be a camera. Again, this is to evaluate the examiner, and if you think it may distract you, you can ask for it to be turned off. If one of the stations during your OSCE is a pilot station, or there is an observer or camera, we will tell you before the exam starts. So to recap, let's take another look at how the OSCE works. You have 1 minute to read the instructions. You have 5 minutes to complete the task, with an announcement when there's 30 seconds to go. After 5 minutes, you then have 1 minute to read the instructions for the next station. It all sounds like a rush, but in fact, you'll find that you have plenty of time. When everyone has visited all stations, there'll be an announcement that the exam is over, much to everyone's relief.
End of the exam. Candidates, please leave the examination hall.
We'll then ask that you leave the examination circuit quickly and quietly, as there may be other candidates waiting. We'll also ask you to collect your belongings from the locker room and hand in your badge, locker key and tickets for other personal effects. Please leave the centre as soon as possible, because there may be another group of candidates waiting their turn. Please don't inconvenience the other users of the building by stopping in the corridors. So, to summarise the main points. You have 5 minutes to complete each task and 1 minute in between stations to read the instructions. There is an additional set of instructions inside each station. There will be a rest station and maybe a pilot station in the circuit. When the exam is over, please hand in your badge and locker key, and please don't forget to collect your belongings.
Good morning everyone, and welcome to part 2 of the Plab test.
Now, before we start, there are a few things we will need to do. When you arrived, you should have switched off your mobile phone or pager and picked up your badge showing your name and unique number, a briefing note and a locker key. Your belongings, including your mobile phone and any pens or pencils, should have been stored in the locker room. Please make sure you wear your badge clearly displayed so that the examiners can check that they have the right candidate's mark sheet. You should sign your candidate letter to record your attendance at the OSCE today, and also to confirm the address where you would like us to send the results. After this video, we'll tell you when we'll be sending them out. One of the GMC team will collect your candidate letter from you. Now, you won't need to take anything with you into the exam, not even your own medical equipment. Anything that's needed for the exam will be provided. If you have any questions after watching this video, don't hesitate to ask one of the GMC team here. And finally, relax. You will have done most of these tasks many times before and with real patients in the real world. So please enjoy demonstrating your hard-earned professional skills.